Hi everyone, my name is Robbie.
I'm Mary.
I'm Mohammed.
Today we will be reviewing a health assessment of the peripheral vascular system. This system is composed of vessels for transporting fluids such as blood. To assess the patient, you want to first gather subjective data. For a focused study, begin by asking if the patient has had any leg pain or cramps. If yes, ask where is the pain located? Can you describe the pain? Is it burning, aching, cramping, stabbing? When did it begin? Gradually or suddenly? What worsens the pain? Is it walking, going up the stairs, elevation, cool temperatures, exercise? Any recent changes in the exercise? Maybe did you try a new one? Did you start exercising more? If yes, the pain may be of musculoskeletal origin instead of vascular. Ask what relieves the pain? Dangling, walking, rubbing. Does the pain disturb your sleep? For a male patient, is the pain related to any changes in sexual function? Aortoiliac occlusion, a type of PAD, which we'll get into what that means, pertains to the blockage or narrowing of the aorta or iliac arteries, is associated with erectile dysfunction. This is known as Leriche syndrome. These questions help to determine the possibility of peripheral vascular disease, PVD, which is the narrowing or occlusion of the blood vessels outside the heart. Peripheral arterial disease, PAD, is a specific type of PVD in which the inner layer of arteries and arterioles narrow primarily because of arteriosclerosis or hardening of the arteries. With PAD, blood flow cannot meet the demands of muscles during exercise, so people may sometimes experience muscle fatigue or pain when walking, also known as claudication. Moreover, aging adults commonly experience night leg pain, which may point to ischemic rest pain of PAD, severe night muscle cramping, or restless leg syndrome. The nurse should also ask if the leg pain is associated with any skin changes on the arms or legs. If yes, ask, what changes have you noticed? Redness, pallor, blueness, brown discolorations. Is there a change in temperature of your skin? Is it more warm or cool? We ask this because coolness occurs with PAD. Also, do your leg veins look bulging and crooked as with varicose veins? Have you done anything to treat it? Do you use support hose or compression stockings? With PAD, compression stockings actually worsen symptoms by further impeding blood flow. You can also ask, do you have any leg sores or ulcers? This is because leg ulcers occur with chronic arterial and venous disease. If yes, where? And does it bring about any pain? Furthermore, to assess for edema, which is excessive accumulation of tissue fluid, the nurse should ask if they are having swelling in their arms or legs. If yes, ask, is the swelling happening in one extremity or both? Bilateral edema is generally caused by systemic issues such as heart failure, while unilateral edema is caused by a local obstruction or inflammation. You can then ask, is the swelling at its worst? Well, when is it at its worst? Upon waking up or after being up most of the day? How long does the swelling last? Is it coming and going, constant? What worsens the swelling? Trauma, standing for a prolonged period, sitting? What relieves the swelling? Elevation, support hose? Does anything come along with the swelling like pain, heat, redness, ulceration, hardened skin? Moreover, to assess for infection, malignancies, and immunologic diseases, the nurse should ask about lymph node enlargement. If the patient reports feeling lumps in the body, ask where? How long have they been there? Are they hard or soft? Do they cause any pain? Are you experiencing any sort of infection that you are aware of? The nurse should also collect important medical history, such as history of vascular problems, heart problems, diabetes, obesity, pregnancy, hypertension, trauma, prolonged standing, bed rest, or smoking. Smoking is actually a key risk factor of PAD because the nicotine found in tobacco causes vasoconstriction, increases coagulability, damages endothelium, and promotes inflammation. Additionally, the nurse should ask about medications the patient is taking, since they could cause hypercoagulable states, as with oral contraceptives and hormone replacements. Next, to complete a physical examination of the peripheral vascular system, a nurse will need a paper tape measure to measure the circumference of a patient's calf if the lower legs look asymmetric or deep vein thrombosis is suspected, and also to measure the ankle circumference of a patient with peripheral edema to determine if it is increasing or decreasing. A nurse will also need a blood pressure cuff, Doppler stethoscope, and Doppler ultrasonic probe to perform ankle brachial index, or ABI, measurement, which is the first non-invasive test performed for PAD. The Doppler stethoscope amplifies the sound of blood flow in the arteries to help identify a pulse. The Doppler ultrasonic probe uses ultrasound waves to measure the blood flow velocity and systolic pressure. The cuff temporarily occludes the arteries upon inflation to create blood pressure changes.
Moving on to the universal precautions of performing a peripheral vascular disease exam, performing hand hygiene is the best practice to protect healthcare workers and patients from infections and prevention of transmission for diseases. Keeping the room temperature at 72 degrees Fahrenheit stops both vasoconstriction and vasodilation. It helps to conduct a thorough assessment of the peripheral vascular system. There are various levels of precautions present at a hospital setting. A nurse should check the size on a patient's door or charts to ensure they don appropriate PPE before assessing the patient. This is another method of protecting the patients and limiting the spread of microorganisms in a hospital setting. Nurses should also disinfect any patient care equipment needed for assessment. This includes the nurse's personal stethoscope, as they will also be using it for future patients from one room to another. We begin the assessment by inspecting the appearance of skin on both upper and lower extremities. Look for even skin color and if there are any areas lighter or darker in comparison. Check for skin tugger to ensure an accurate level of hydration in patients. And we also inspect for local temperatures and compare them bilaterally. In lower extremities, take extra precautions of assessing for coldness. Inspect for skin texture and describe if it's dry, soft, flaky, moist, etc. Inspect for an even distribution of hair throughout the extremities. Also note any lesions, traumas, bruising, or open wounds found within these extremities. Check for clubbing in all fingers by asking the patients to create diamonds with their nails. Profile sign is viewing the finger from the side and it helps to detect any early signs of clubbing. The normal nail bed angles at 160 degrees and any higher indicates clubbing. Check for capillary refill with the person's hand near the level of their heart. It should refill within 3 seconds. Check for symmetry in extremities bilaterally. Note if any extremity is shorter than the other when compared. When assessing the arms, begin by palpating both radial pulses. Note for rate, rhythm, elasticity of vessel wall, and equal force. The grade of force is rated on a 3-point scale, 0 being absent to 3 being increased bounding. Ulnar pulses are unnecessary to palpate as they are non-palpable in healthy people. You may assess the ulnar pulse by palpating along the medial side of the inner forearm. Brachial pulses are only palpated under the suspicion of arterial insufficiency. They should be bilaterally equal. The epitracheal lymph node is found in the depression 2 to 3 centimeters above and behind the medial condyle. Shake the person's hand and palpate the person's elbow to the groove between the biceps and tricep muscle. They are not usually palpable. The modified Allen test evaluates the adequacy of collateral circulation before cannulating the radial artery. Firmly occlude the ulnar and radial arteries of one hand while the person makes a fist several times. Ask the person to open the hand without hyperextension. A palmar blush indicates adequate circulation and a return to the standard color of the hand in less than 7 seconds. Although the test is simple and valuable, it is relatively crude and subject to error. It requires the patient cooperation, which is difficult under emergent scenarios. Palpate legs for any atrophy, asymmetry, or swelling. If lower legs are suspected of DVT, measure the calf circumference with a non-stretchable tape at the widest point. Repeat the process on the same point on the other leg and record both findings in centimeters. Palpate femoral, popliteal, dorsalis pedia, and posterior tibial arteries. Note for rate, rhythm, elasticity of vessel wall, and equal force. Regular popliteal pulse is often impossible to palpate. In patients over 45 years of age, dorsalis pedia is hard to find. Check for edema by firmly depressing the skin over tibia for 5 seconds and releasing. 4 plus is considered pitting edema, and the indentations last for a long time. When the arterial deficit is suspected, raise the legs about 30 centimeters off the table. Then ask the patient to move their feet for 30 seconds. This drains off venous blood, and skin color only reflects the contribution of arterial blood. A dark-skinned person's soul reveals extreme color change. Let the patient sit up with legs over the side of the table. Compare the color of both extremities and note how long it takes for the color to return. When a patient presents with a weak peripheral pulse, use the Doppler ultrasonic probe to monitor blood pressure in lower extremities. The device magnifies pulse sounds from the heart and blood vessels. The patient should be in a supine position with legs externally rotated. While there are many assessments for DVT present, the most accurate is the Wells score. It groups patients into low, moderate, or high probability of DVT based on clinical characteristics and manifestations.
Components of the health assessment in regard to arms includes the pulses, assess the radial, ulnar, and brachial pulse in both arms. Normal pulse strength is 2 plus. Symmetrical left and right arms. A weaker pulse on either side could indicate an arterial dysfunction. Use the stethoscope to oscillate if pulses are difficult to palpate. Skin changes. Observe for pallor, which indicates poor blood circulation due to an arterial obstruction. Cyanosis, which indicates lack of oxygenation, and redness, which indicates inflammation or infection. Check for local skin changes, such as lesions. Capillary refill. Test by pressing on the nail bed and observing how quickly color returns. Normal refill time is less than 2 seconds. Delayed refill indicates poor circulation. Components of the health assessment in regard to legs. Palpate the femoral, popliteal, dorsalis medius pulses in both legs. Pulses should be symmetrical and strength should be 2 plus. Weak or absent pulses could indicate peripheral arterial disease. Edema. Check for swelling by pressing and noting if pitting occurs. Grade any pitting on a scale of 1 to 4, mild to severe. Unilateral edema could indicate deep vein thrombosis. Skin appearance. Look for viscosities, discoloration or ulcers. Feel for bilateral warmth or coolness. Limb assessment. Check for symmetry in size and shape. Observe for signs of muscle atrophy, which could indicate poor circulation or nerve damage. Documenting potential normal findings. Radial, brachial, femoral, and popliteal and dorsalis medius pulse could be 2 plus and symmetrical bilaterally. All pulses should be palpable. Capillary refill should be less than 2 seconds in all extremities. Skin should be warm, dry, and intact, with uniform color and no lesions, discolorations, or ulcers. Hair distribution should be even and no signs of atrophy should be noted. No edema should be observed in arms or legs. Arms and legs should be bilateral, symmetrical in size and shape. Documenting abnormal potential findings, which could include right dorsalis medius pulse, in which it's absent. Radial pulse on the left could be diminished. Delayed capillary refill, more than 3 seconds in toes of the right foot. Brown pigmentation noted around lower ankles, indicating chronic venous stasis. Cyanosis observed in the nails of the left hand. Ulcer present on the right ankle, approximately 2 centimeters in diameter, with irregular borders and excessive drainage noted. Localized swelling in the left calf with warmth and tenderness upon palpation, which may indicate deep vein thrombosis. Symmetry, right leg larger than the left with 3 centimeters difference in calf circumference. Variations for age, gender, and ethnicity. Older adults often have weaker pulses and may have delayed capillary refill. They are also more likely to have varicose veins or peripheral arterial disease. Children typically have stronger pulses and faster capillary refill, but check for congenital issues like heart defects. Pregnant women often experience swelling and varicose veins due to increased blood volume and pressure on veins. Men tend to have higher risk of arterial problems like peripheral arterial disease. Ethnicity. For patients with darker skin tones, look for signs of pallor or cyanosis in the mucous, membranes, nail beds, or lips instead of the skin. Consider cultural factors like tight clothing that may affect circulation. Thank you. We hope this presentation provided insight on how to assess the peripheral vascular system.